Welcome to week 6, Challenges Facing Workers' Compensation, What Medical Tourism Needs to Do. In this lecture, I would like to talk about workers' comp at the crossroads, internal and external challenges, seismic shifts, the year of awareness, storm clouds in the near future. Financially, work comp is looking better but not profitable. Not all workers hurt on the job report problems, and some internal challenges, opt-out expansion, rising costs, impact of ACA, which is Affordable Care Act, constitutionality of exclusive remedy, external challenges such as media reports on inadequacies of workers' comp, and how injured workers are treated by systems supposed to protect them, and other challenges on the horizon. Let's first talk about challenges. The opt-out expansion with the Association for Responsible Alternatives to Workers' Compensation, which views option as a positive competitive complement to workers' comp, not a replacement. It's funded by nearly 24 major corporations such as Walmart, Lowe's, Safeway, and Nordstrom. It's a multi-state lobbying to allow private employers to opt out of state workers' comp systems. It's conservative. Southern states such as Florida, Georgia, and Alabama is on the group's short list and has written legislation for Tennessee. Legislation has been deferred to next year, and South Carolina legislation introduced it in May 2015. Now, the goals for the employees is delivery of better medical outcomes and higher process satisfaction for injured workers, improved workplace safety and training supporting injury and prevention, expanded access to quality medical providers providing exceptional care, opportunity for expanded benefits through custom design plans, more expedient medical treatment, and more referral to specialized medical treatment to enhance recovery. Now, some of the goals for the employers are improved incentive for existing workers, compensation providers to improve services and prices, incentives for medical providers to act in the best interest of the employee and improve in levels of service, expanding employee access to medical providers who do not accept workers' comp, and an injury benefit plan that can more efficiently deliver care to and achieve better medical outcomes for injured workers. Now, the criticism of the opt-out legislation is it's been criticized as limiting injured workers' rights to medical benefits, and workers are taken for granted. Better medical care and return to work rates are alleged without evidence. The Texas system cited without qualification as a success, and resistance to legislation to enforce ethical and equitable behavior on part of the employers and improve compliance with laws on the books. Absence of transparency. 100,000 or 90% of employers in Texas failed to file required reports. Worker intimidation. If an injured worker seeks advice from a personal physician, they could lose their benefits. This shows the rising cost for medical costs for lost time claims approaching $30,000. The average medical cost per lost time claim, this was as of May 2015. And as you can see, it has spiked in over time. Also, this is a comparison of actual and preliminary costs. So as you can see with the blue, that's your average medical cost per lost claim. And then in orange, that's the average medical cost per lost time claim. That is the actual number of what that looks like. So when it comes to rising costs and hospital costs, The outpatient cost is still rising. States with a percentage of charge of fee schedules or no fee schedule had highest payments to hospitals for outpatient surgical episodes for knee and shoulder injuries. State with no fee schedules had 60 to 141% higher payments per episode compared with states with fixed amount schedules. Tremendous variation in rates of change in hospital payments per surgical episode across states. South Carolina saw a reduction of 31% in average hospital payment from 2006 to 2013, and Alabama grew at 81%. So states with percentage of charge-based fee schedules or no fee schedules had more rapid growth than states with other regulations. Most percent of charge-based states experienced growth that was 157 to 286% faster than median of states with fixed amount of fee schedules. How does the Affordable Care Act impact this? There was a doctor shortage, or it's been projected that a doctor shortage would be by 2025. The U.S. will be short 46,000 to 90,000 doctors by 2025, according to the Association of American Medical Colleges. And the Association of American Medical Colleges estimate shortage of primary care physicians will be 12,500 to 31,100 and 28,200 to 63,700 non-primary care physicians, most notably among surgical specialists. The total physician demand projected to grow up by 17%, with population aging and growth accounting for majority. And ACOs may shift claims into workers' comp. The Workers' Comp Research Institute found that millions of claim dollars may be shifted into the accountable care organizations. Now, the hospital closures are due to failure to expand Medicaid. Hospitals in Kansas, Kentucky, Louisiana, as well as other states that rejected Medicaid expansion, they're struggling. And so 283 mostly rural hospitals are in financial trouble. And since 2010, 48 have closed. Failure to expand Medicaid could lead to cost shifting to workers' comp, and problems will arise unless states expand their Medicaid. Problems due to two things. Cost pressure placed on facilities and health systems will lead to increased pressure to cost shift. 6.4 million adults who remain uninsured will be less healthy, have more incentive to get care under workers' comp, and heal more slowly. Constitutionality of exclusive remedy. And what is that exclusive remedy? It protects employers from common lawsuits by employees to recover for work-related injuries. It limits a worker's remedies for work-related injuries to a workers' compensation claim against the employer. And there's a trade-off of compromise where both employers and employees give up certain advantages in return for others, so-called grand bargain. Employers trade liability regardless of fault for protection from large tort awards, and employees surrender a cause of action in return for swift but limited financial benefits. Now, constitutionality is various reforms over the years have devalued the workers' comp program, that it can no longer meet its constitutional declared objectives. Plaintiffs in one Florida case called Julio Cortez versus Velda Farms alleged comp system became unconstitutional as an exclusive remedy in stages as lawmakers made changes that slowly eroded benefits and protections. Plaintiffs asserted that anytime legislature takes away a right, it must provide a reasonable alternative. And Miami-Dade County Circuit Court Judge George Kudo ruled in that Paget versus State of Florida that the exclusive remedy provision is unconstitutional. In continuing constitutionality, the basis of ruling was that over the years, Florida Workers' Comp Act benefits have been eroded as to no longer serve as an adequate remedy. District Court judge in Oklahoma ruled that its state workers' comp law does not provide exclusive remedy for foreseeable injuries. And a judge ruled that employee could sue his employer because his injury was foreseeable and therefore employee did not suffer a compensable injury under Oklahoma workers' comp law. The Florida 3rd District Court of Appeal ruled in June, and plaintiffs in Paget had no legal standing, constitutionality upheld, but plaintiffs will continue to change constitution. Media reports are those exposed deficiencies in workers' comp systems where there's demolition of worker comp, which are reforms pushed by big businesses and insurance carriers, have dismantled state workers' comp systems. They have cutbacks, have been drastic in some places. They guarantee workers will plummet into poverty, and workers often battle insurance companies for surgeries, prescriptions, and basic help doctors recommend. And then there's the fallout of workers' comp reform, where 5 case studies revealed real-life impact of rollbacks spreading across the country. So how much is your arm worth? Depends on where you work. So found that there was some different compensations for identical injuries. Example, an arm injury in Alabama was $49,000, whereas in Georgia it was $118,000. Interesting. Now, as far as OSHA reports, adding inequality to injury, the cost of failing to protect workers on the job, more than 3 million workers seriously injured every year, and thousands more are killed on the job. Financial and social impacts of injuries and illnesses are huge, with workers and their families and taxpayer-supported programs paying most of the cost. Workplace injuries create a trap which leaves them less able to save for the future or make investments in skills and education. Injuries contribute to issue of income equality. As far as the Mother Jones article, it criticizes push for opt-out legislation, and industry response is slanted, reported public disservice, biased view of work comp system, facts not substantiated. Injured workers denied basic medical care and services as well as adequate compensations, leading to impoverishment. And so the ProPublica, NPR, and OSHA reports lost limbs, delays in treatments, etc. There's an article called "They Shoot Horses, Don't They?" discusses why injured workers are subjected to various indignities after suffering a work-related injury. Big businesses largely believe workers are disposable. Workers are injured on the job are cast aside. Large corporations' attitudes toward worker and treatment of workforce can be summed up by one word: exploitation. Work of ARAWC cited as a new reform trend, taking workers' rights back to time when they had no recourse for injuries, and as a result, became impoverished or died. Seismic shifts. That's an essential guide for practitioners and CEOs in workers' comp. A report by Peter Roshner earlier this year found next big wave is already here for workers' comp industry, offers contrasting view of industry direction over the next decade. Workers' comp industry is shrinking. In 1993 to today, number of serious work industries dropped by over 35%. Today, through 2022, work injuries will likely drop by 35% again, and the study of impact automation suggests that over the next decade or longer, injuries may be cut in half. Cites Texas as an example of the shrinking industry. In 2013, Texas private sector workforce incurred 30% fewer lost time injuries than in 2004. As the typical claim is increasing in complexity, total number of claims are decreasing. The seismic shifts, there's another factor behind shrinking of workers' comp claims. The shift from manufacturing to service. Entering into the 20th century, service sector roughly equals to goods producing sector in share of national output. Change began in 1920s. By 1960s, the service sector eclipsed industry in creating economic value. Employment in services climbed from 55 to 85% of total employment. Manufacturing employment, 70% male, dropped precipitously, and revival of manufacturing using a fraction of workers employed in the past. Manufacturing employment much safer today. Risk of time loss injuries, same as service sector. In 1994, for every 10 manufacturing injuries involving 1 day's lost time, there were 8 service sector injuries. In 2012, for every 2 manufacturing lost time injuries, there were 10 service sector injuries. There are top 4 reasons for declining injuries and claims. Workers may be reporting and claiming less out of intimidation or unhappiness with the benefit package, which has shrunk in past decades. Employment sector shifts, notably in sharp reduction of high-risk manufacturing jobs, continuation, if not acceleration, of injury declines without collapse of employment in a major high-risk sector. Employers are devoting more attention to work safety. Lost time claims have fallen faster than injuries. Employers are pushing down lost time claims by stay-at-work arrangements or expediting return to work before convalescence goes on long enough for a worker to qualify for lost time benefits. Employers have assumed more exposure to claims costs through self-insurance and high deductibles. Claims costs may also decline. Cost of claims likely to moderate in growth and even decline in the near future. Most up-to-date data on medical costs and workers' comp indicates that past years' annual increases per claim in the 5 to 10% range have decreased 3%. Correlation exists between general healthcare costs and medical cost trends in workers' comp. Increases in cost of healthcare have moderated through all lines of industry. Medicare, health insurance, and workers' comp cost of claims likely to follow suit. High deductibles and health plans may induce individuals to seek medical care and workers' comp. For the foreseeable future, case can be made that core medical cost index in national health care will remain low, and workers' comp that can translate into a flat rate of 0 or in selected areas a negative rate. Other shifts are technology, more transparent, analytical, and collaborative claims data, and diversification, where there's integrated disability management, total absence management, health and productivity management. What do medical tourism needs to do? Be prepared. Whatever happens in the workers' comp industry, the medical tourism industry needs to be prepared to expand into and handle medical care for injured workers. Educate yourselves on the issues related to occupational illness and injury, as well as the deficiencies in the current U.S. system that would open itself to medical tourism. Market other services such as orthopedic surgery, rehabilitation, physical therapy, medical prosthetics. Attend risk management and worker comp conferences in the U.S. to learn more about the industry and its need for the future, whatever direction it takes. Have transparency. Provide accurate pricing, cost of services, outcome data, and success stories to industry leaders. Convince skeptical thought leaders and industry personnel that medical care outside the U.S. is equal to or better than what is available domestically. Change the perception. Thank you.